Hello everyone. So this video we will speak about the communication with colleagues, which is the third domain of part 3 exam. So you may wonder where in part 3 exam we may be in communication with other colleagues. I will tell you. So you have one station for teaching, and you will have a junior colleague who is asking to be taught about a specific thing, like someone who is asking to learn more about, for example, how to deliver a breech baby, or asking how to do a kiwi vacuum delivery, or how to do forceps delivery, or how to write a discharge summary, how to write a post-operative notes. So there are lots of teaching stations. You will have one of them in the exam, and this is the ideal station that will evaluate your communication with colleagues and your skills in that field. So the communication here will be with your junior colleagues, but there are also communication with your senior colleagues you may find in the exam. So sometimes in the structured Viva discussion, when the examiner asks you to summarize this, like the case for him, you have to put it in a specific tool of communication. We call it a SBAR tool. Okay, I will explain everything in details soon. So you have to deliver or summarize the information for him in like a regulated format, which is called the SBAR tool. And sometimes the station itself may be a call for a consultant. So the station itself, you may be the registrar on call in the labor ward, and you have a specific patient, and you need to call your consultant and ask him, or you want something from him in this regard. So you want him to come to evaluate the patient, or you want to confirm that he is happy for your plan of management or anything like that. Also, this call phone should be in SPAR tool. Okay, so let's start with the communication with the senior colleagues. As I told you, it's called a SBAR tool. SBAR is just an abbreviation of the word. So S is reflecting the situation, B is the background, A is the assessment, and R is the recommendation. So S is the situation. We have to start with the situation. We can't start with the background. So if you are calling your senior colleague to inform him, for example, you have a PPH in the labor ward, and it is a massive PPH, you want to call your consultant to come. So don't call your consultant, hello, I'm Nisreen, I'm the doctor on call today. I have a patient who is para to 39 weeks. She had a PIH in pregnancy, and she had a small gestational age baby. We can't tell the background history in the beginning of the call. We have to start with what situation we are now. So the first thing in situation is just to introduce yourself and tell from where you are calling your senior colleague. So hello, I'm Nisreen. I'm the registrar on call. I'm calling from the labor ward. And we have to tell who is the patient we are speaking about. I'm calling you to take your opinion, or to ask your opinion, or to ask you to come for a patient called Sarah June, who is laboring in room 3, for example. Okay, and then describe your concern. Why I need you to come? Because she lost about 2 liters of blood, and on her background history, like that. So you have to set the situation first. So you told your consultant that the patient is bleeding and you want him to come. So that is the situation. Then the background comes next. So first we start with the situation, then we will follow it with the background. In her background history, she is prime-nib, she is 39 weeks, she has been admitted 2 days ago, and she has been induced for PIH and so on. So this is the background history, okay? And the assessment. So first situation, then background, then your assessment. I assessed the patient and her observations are stable, but she is little tachycardic. Okay, I examined her abdominally. The uterus is very lax, and vaginally she is having active vaginal bleeding. No trauma to vaginal wall, no remnant tissue by bedside scan, and my recommendation. So my provisional diagnosis is a massive VPH. So my recommendation that I need you to come here and we may manage her in theater. So we are going to inform the lab. We are going to call the theater team. We are going to preserve the blood products and take her to theater and do our first aid measures. Okay. So that's how you formulate the communication skills. So if you got a call in the exam, the station will be the call. The consultant will be in front of you, who is the examiner, pretending as your consultant, and you will pretend that the person who is calling, and he will answer you. So you have to start the call like that. Hello, I'm Nisreen. I'm one of the doctors, or I'm the registrar on call today in the labor ward. And I'm calling you regarding a patient called Sarah June. She is laboring in room 3 now, and she has developed massive BPH. She lost about 2 liters of blood right now, and that's why I'm concerned. On her background history, she is like that, and my assessment that she is like her observations. Observations means the vital signs. Okay, her observations are stable. I examined her. Generally, she's alert and responding. Abdominally, the uterus is not well contracted, and vaginally she has active bleeding, no trauma to the vagina. And my provisional diagnosis is just she has atonic postpartum hemorrhage. My recommendation that I just need you to come and review her, and we are going to transfer her to theater now. We are going to inform the blood bank, the laboratory, and we'll do our first aid measures by putting the 2 wide bore cannula, and we will start IV drip. We'll shift her to theater for proper management, and then that's how you communicate. Sometimes this communication is not only a call between you and your consultant, it sometimes is a referral. So sometimes you may need a microbiology opinion in a case with sepsis. So when you call him, hello, I'm Nisreen, I'm the Ops and Gynae registrar on call, calling from the labor ward. I'm just calling regarding a patient name like that, and her date of birth is like that, her hospital number is like that. And she is a postnatal lady with sepsis. So her background history, she is type 1 diabetes on insulin, and she had a C-section like 7 days ago. She presented with fever like this. Okay, so how you communicate with your senior colleague is the same how you communicate with other specialties colleagues as well. Okay, so that's where you will develop the skills between you and your colleague in terms of communication, and it should be in this frame. You can't deliver the information about any case to any of the consultants or any of your colleagues without putting it in a SBAR tool. Even if you are in the exam and you have a structured Viva task, if the examiner asked you to summarize the case for him, you tell him, in her situation like that, in her background history like that, my assessment is like that, and my recommendation is like that. Okay? If you fulfill these 4 items in delivering or communicating the information between you and your senior, you will get the full mark in the communication with colleague. This is very, very important. Okay. Coming to communication with the junior colleagues, this is also very important because you must have a teaching station in the exam, so that they will assess you how you communicate with your juniors. So you have to offer continuous teaching and continuous training, and advise him to come and attend further sessions like that. And you have to offer your support and help for the newcomers. So he will tell you in the station, you got a new colleague, he just recently joined the department and he wants to learn more about forceps delivery. So you introduce yourself by name and role. Please don't tell, I am Dr. Nisreen, I'm one of your senior colleagues. This is not good. You have to tell him, hello, I'm Nisreen. You have not to put doctor in front of your name at all. So I'm Nisreen, I'm one of the doctors here in the department, and I assume that you are the one who recently joined our department. Is that right? And then you confirm his or her name, and then you ask him, how's everything going so far? Have you enjoyed the specialty yet, or you didn't go much through? You can just start, like, build a rapport between you and your colleague, and because the newcomers are still not merging well with the new department, and they need some support and help from others. So yeah, so you need, if you find he's doing some mistakes, uh, please avoid blaming. Okay, you will find that in the exam sometimes he may do something wrong in front of you. Don't tell him, no, it's not like that, you didn't do it right. No, that's not good. You can tell her, oh, I appreciate your trial. That's so great for you that you need to learn more and more. So let me show you how we can do it more perfectly. So it's like that. Okay. So please avoid blaming environment and avoid being judgmental. So if he, for example, filled a discharge summary, but he has not filled some point, which from your point of view is very important, but he doesn't know because he didn't include the date of admission and date of discharge. He didn't include blood group for the patient or the expected estimated blood loss for the patient, for example. So you can't tell him, oh, this is not a good discharge summary, I will do it myself. No, don't judge on his work. So you can tell him, oh, is it your first time to fill a discharge summary? Then he will tell, yes, that's my first time, I have no experience before to do it. Then you tell him, oh, I appreciate your trial, this is very good from you that you want to merge with the system soon. So let me go with you through the discharge summary and see how can we make it more reliable. Okay, and then you go for the items that he filled first and appreciate that, and then what he missed, and you tell, would it be better if we include the date of admission? Would it be better if we can add the date of discharge, so we will have an information telling us how long this patient stayed in the hospital? That would be good, right? Okay, do you think that? So after you finish, so can you just have another look on your discharge summary, fill everything according what we discussed now, and then come back to me and we will have a look again together. Okay, so like that. And also we need to screen for anything like bullying or undermining, because some of the newcomers, they may be subjected to some bullying from some colleagues, and this is a very serious thing. So in the beginning of your station, you can ask him, I understand that you are the one who recently joined our department. How's everything so far? Do you like it? And anything, if everything is anything going well so far? Do you have any concern, or you feel anything, or have you seen anything not right to you? So please don't feel free to come and speak to me if you feel anything which may like which may you feel that it is not right, or you feel uncomfortable with any situation. Please come and speak to me. I'm very happy to help you, and I can offer you my full support, and I'm at help at any moment. I will give you also my contact number. You can call me at any time if you need that. So if you tell your colleague like that, you will get the maximum mark in the communication with your colleague. Okay. So it's a very easy domain, which is which can be assessed from the teaching station only, or from the teaching station and others while you are communicating with your colleagues, or like consultants, or communicating with other departments. Okay. Thank you.